Assalamu alaikum. Today we are going to start cardiology from step up to MRCP by Dr. Khalid, and first topic is long QT syndrome. Actually, the QT interval is related with the ventricular contraction or ventricular activity. We can see because ventricular activity is seen in the ECG in the form of QT interval. Now, normal QT interval or the corrected QT interval is 350 to 430 milliseconds. Okay, whenever it is increased more than this range, then that is the long QT syndrome. Now, coming towards the introduction, it is an inherited condition. The syndrome is an inherited condition that is associated or that is due to the delayed repolarization of the ventricles. Okay, and this delayed repolarization of the ventricles, when it continues, it can later lead to ventricular tachycardia, and therefore when there is that ventricular tachycardia, it can present in the form of collapse, syncope, or sudden cardiac death. It is three most common variants, and from them the most common are LQT1 and LQT2, and LQT2, and these are caused by the defects in the alpha subunit of the slow delayed rectifier potassium channel. So the main problem here is the potassium channel that is defective, and which is components, that is the alpha subunit. It is defective, that leads to delayed repolarization of the ventricles that will present in the ECG in the form of long QT interval that will be greater than 350 to 430 milliseconds. Now the normal QT, coming towards the normal QT interval or normal corrected QT interval. Normal corrected QT interval is less than 430 milliseconds in the males, while it is less than 450 milliseconds in the females. Now, coming towards the causes of prolonged QT interval. These are three categories for the causes for the conditions that can cause prolongation of the QT interval. So here we have three categories. These are congenital and some drugs that can cause, and there are other categories. Okay, so first coming towards the congenital category. In the congenital category we have two syndromes. One is the Jervell-Lange-Nielsen syndrome and other is the Romanov-Watt syndrome. Now the potassium channel involved in the Jervell-Lange-Nielsen syndrome, that is the JLN syndrome, is present in cardiac myocytes as well as in the hair cells of the ear or in the internal ear. That's why if that potassium channel is defective, that will lead to sensory neural deafness as well as the long QT syndrome or the cardiac pathology also, that is the LJN syndrome. While in the Romanov-Watt syndrome, the potassium channel that is defective is not in the hair cells or in the internal ear, hence no deafness is seen in case of the Romanov-Watt syndrome. Remember these things, these are the important features that can come in this scenario. Now coming towards the drugs that can cause long QT syndrome. These drugs are very important. Now first coming towards the amiodarone. Amiodarone, we know that what is it? It is antiarrhythmic drug. Okay, but it is also proarrhythmic drug and it can lead to long QT syndrome. Sotalol, that is a beta blocker that can also lead to this condition. Other is class 1 antiarrhythmic drugs like procainamide, these kind of category. Then we have the psychiatric medications like TCA that include the amitriptyline, that is a TCA that is given to the patients of the depression. So in the scenario, a patient with major depressive disorder taking some medication now presents with the collapse. What is the condition? ECG shows these findings that we'll see later on. There will be QT prolonged, and they can ask that what kind of medication he was taking. So probably he was taking the amitriptyline, or he can be taking other SSRI like the citalopram or sertraline, and other most important drug, that is the lithium, that can also cause long QT syndrome. Other is the methadone, chloroquine, that is the anti-malarial drug. Then we have mefloquine, even terfenadine, that is the antifungal drug, and then macrolides. So macrolides like erythromycin and clarithromycin. Now in this condition, patient can present with the scenario of like sore throat or any other condition that in which antibiotics like erythromycin and clarithromycin are given, and patient will present us with some condition that is caused by the bacteria, and patient is taking some kind of medication, or even they can tell us the name of the medication, and we'll see that now patient is presented us with the syncope or this type of symptoms, and her ECG again, his or her ECG will show us the same pattern, that is QTC will be prolonged. So which medicine is this? That is the erythromycin or clarithromycin or other medicines that we have discussed, that these can come in the scenarios, and we have to stop these medications. We'll see that in the management section, inshallah. Then we have the levofloxacin, that is again antibiotic, domperidone. Then we have domperidone, ketoconazole, haloperidol, tacrolimus. These are also important medicines that we should remember. I have told you some scenarios that are most commonly seen in the patients. Now